Is part two to the structured reflections for the knee. History for this one, the patient had presented to the emergency department 2 weeks prior. Originally I said same injury or new. Obviously, after like watching this back or like reading this back and thinking about it, obviously it's the same injury that they went to the emergency department for originally, which tells me this is kind of like ongoing, probably an acute mechanism with a chronic issue. um, Occurring during volleyball, so probably some sort of running, jumping, landing, cutting, or diving injury. Um, where he had jumped and landed, so a concentric and eccentric motion muscularly, predominantly on his left leg, causing it to buckle. So now I'm thinking some sort of injury related to a hyperextension or if they play volleyball concurrently, then maybe some sort of chronic issue that got exacerbated with this acute incident, something along those lines. Had immediate discomfort in the joint. So again, ligament, muscle, meniscus, maybe bone. Persisted as a dull throbbing pain. So now I'm kind of taking away the bone. It's probably not going to be something like that, but maybe a bone bruise of some sort. Um, no painful popping or clicking, so probably not a full meniscus tear. Um, Probably not some sort of ligamentous tear. Um, but still possible, still on the list. Additionally, the patient's knee did not catch or lock and had not been giving out, so structurally seems or sounds fairly intact, all good. Had noted pain with ambulation, using stairs, sitting for a prolonged period of time, and rising up from sitting. So what I'm hearing is pain with movement, specifically flexion, seems to cause a lot of issues. The prolonged sitting kind of is like a theater sign kind of vibe. Um, and then tenderness is where I'm leading, muscularly wise, just because of the using the stairs and the rising from sitting, things like that. Working within the flexed position is basically what I'm thinking. The patient had been using a straight leg immobilizer and crutches to assist with ambulation and taking ibuprofen for his pain. So obviously some sort of pain and inflammation happening because of the ibuprofen. Straight leg immobilizer just for comfort. So again, flexion causes more pain than extension. The only thing that we don't know from that is whether he was fully non-weight bearing or if he was partially weight bearing. Physical exam, soft tissues noted to have mild swelling. So not effusion. It just looks like soft tissue swelling here. Patient's gait was antalgic, so a limp. We just don't know whether it was due to pain or to a structural issue. I'm leaning more towards pain simply because up towards the top, we're not seeing any catching, locking, or giving out. So structurally, he sounds okay. Palpation joint line was tender laterally, so we're looking at LCL, meniscus, IT band, lateral structures, hamstrings, things of that nature. Facet pain due to palpation. So now I'm kind of thinking maybe fat pad or cartilage on the back of the patella as well. Neurovascular intact, including motor, sensory, and pulse examination. Reflex was 2 plus, which is just within normal limits. Knee flexion to 90 degrees, so obviously a lot of flexion missing here. Again, could be due to the inflammation, could be due to a structural issue, maybe not really leaning that way. And then most likely pain and the inflammation. Same with the terminal extension that they're lacking. So first, I said possibly a patellar fat pad impingement, which we see a lot with hyperextension injuries, which is kind of what they had here, according to what I'm picking up, which is the acute trauma and then landing predominantly on the involved leg with buckling. Typically, that's what we hear of described whenever it's a hyperextension injury, which can pinch that fat pad. The immediate discomfort, the dull achy pain, the lack of popping, clicking, catching, or giving out. So like again, structurally all cool. Basically just bruised that fat pad. The pain with the flexion movements, Swelling would be I have seen swelling with fat pad contusions, not much, but a little bit, and it's all soft tissue swelling, not the intracapsular. The limping, the facet pain was a really big one for this, and then having no neurovascular issues, and then the lack of range of motion. The only thing that's kind of against it is kind of the lateral joint line pain, but it is possible that there was some lateral tracking maybe of the patella when this happened as well, which could have caused some sort of bruising or a hit to the lateral joint line, or it's just a combination of another injury that happened at the same time. Then we come down to a meniscus contusion. Again, I'm not really thinking a tear at this point because there is no catching or locking or popping, clicking, anything like that going on right now. So again, more contusion versus a full tear or partial tear. The acute trauma, the landing, the compression, the hyperextension could cause some issues in there. If landing predominantly on one leg, could have compressed that meniscus and obviously not the other one. Um, Again, all the discomfort, the lack of flexion and extension. This one kind of plays off of the lateral joint line pain, which obviously is possible with meniscus. It's one of the telltale signs. And then elements that are kind of against would be the soft tissue swelling. I personally haven't seen very much swelling when it comes to meniscus in the soft tissue as much as maybe within the joint space. But it's also kind of hit or miss. So again, still a possibility, also a possibility that something else happened in conjunction with this that caused the swelling. Facet pain, I added a question mark just because it could be that the meniscus directly in the area of this facet is making it seem as though it's facet pain, but really it's the joint line area. But again, in conjunction with something with the facet could have an issue. The only thing that's missing to really tell me anything here would be the meniscal testing. Obviously really important, but I didn't write the scenario, so it's possible that the whole point of the scenario is that there is no testing. But in real life, I would hope that whoever's doing the scenario does do some sort of testing other than the neurovascular testing. So kind of like it would be nice if it was there, but if we don't have it, I'm still kind of on that page. Last one is kind of a stretch, because this scenario specifically I wasn't really fond of and couldn't really think of much. So this one's kind of a stretch. Acute patellar tendinopathy, which is basically just where they weren't really feeling it very much before, but over repetitive use, if they played volleyball a lot, then they're probably feeling it now. An acute traumatic event could have stressed it more. A change in activity could have stressed it more. So now they're feeling pain before they didn't, but it's always been there, that kind of thing. So again, the acute trauma, the jumping and landing, obviously jumpers knee super common, the immediate discomfort with adult achy pain, the lack of any structural issues showing. Again, the theater sign and flexion issue with certain movements. Facet pain, again, hit or miss. Technically, the patellar tendon does go straight over the patella, so they could have facet pain. But as I kind of note in this column, well, I guess I didn't note. Oh, in this column, is that we're missing the actual patellar tendon pain if it was this one. So facet pain is like a stretch, but when we're missing the patellar tendon pain, then obviously that makes me lean really far against this. Again, this one was just a crapshoot answer. Um, the range of motion deficits. We wouldn't really see too much swelling with this one or lateral joint line pain. It's a little too far for me to even consider that to be a possibility with this. And then we're missing a history of any knee pain. Again, the patellar tendon to palpate, and then any sort of repetitive motion. We don't know if this was like a random volleyball pickup game or if this is somebody who plays volleyball consistently. So.